Hey, Jessica. How are you? When are you coming in? You're going to make an appointment, or did we already schedule an appointment? Hello, hello. Okay, Wednesday. All right, I'll see you on Wednesday. So, let's see. Waiting for some Facebook people. Okay. Wait, no, not Wednesday. Are you sure? I didn't see you on Wednesday. Okay, I'll double check. All right, so I didn't really have any. Wednesdays are your days off. Okay. All right. I'll come in just for you. All right. I didn't really have a specific topic. I just kind of wanted to go over some things with everybody. In particular, like the specials we have going on right now. And then just updates as far as the things that we're offering at the practice. So I've always offered weight loss with the semaglutide, and now I've got on board the tirzepatide. So that took me a minute to get, but now I've got it. So that's available as well. It's a little bit more expensive than the semaglutide, but I have it. So other than that, the other thing that we are starting is bioidentical hormone replacement. So that's with the pellets, the pellet therapy that get inserted like into the subcutaneous tissue. So I'm done with my training and certification on that. I've just got to finish finding a pharmacy that I like, that I think provides a good product for us, for to get the pellets, and then I need some of the pellet insertion kits, and then I'll be ready to go on that. So how that will kind of work is when you guys come in for the first time for your consultation, we'll go over everything and why you think you need hormone replacement and stuff like that, some of your symptoms, pretty extensive questionnaires as far as your health history, any sexual effects, fatigue, all these little questionnaires I've got for women. I've got a menopause questionnaire, a perimenopausal questionnaire, and then for men, I've got the andropause questionnaire as well. So it'll be a pretty extensive first visit. After that, I will get your blood work, a pretty extensive blood panel as well. And then your next appointment will be reviewing the blood panel and talking about the dosages and prescriptions that I think would help you, as far as pellets go. And then at that point, we can decide whether or not you want to do it. I may provide a hormone replacement like membership. That might be a better option because the insertion, that those first 3 appointments, the blood work and the insertion, can be upwards of anywhere from $700 to $900. So it might be better for some people to just do a hormone replacement membership, which I think will probably be around $200 for women a month and $300 for men a month. And then that will kind of help you space it out because it's going to be an ongoing thing. So after you get those pellets done in 4 to 6 weeks, we're going to do repeat labs to test what your levels are. And then in 3 months after pellet insertion, we're going to test you again and have another follow-up. And then in 6 months, we're going to test you again, have another follow-up. And at the 3 month and 6 month, you'll most likely be getting another pellet insertion. And then after that 6 months, if we've got you stabilized, we will just continue to do the pellet insertion. It will vary based on your metabolism, your lifestyle, how active you are. Most women, every 3 to 4 months, they're getting new pellets, and most men, for some reason, it lasts a little bit longer on them, which you think would be opposite because they got higher metabolism, but most men is every 5 to 6 months. But again, we'll figure that out based on your labs for that first 6 months or so. And then once we get that kind of stabilized, we'll just do yearly labs, and then you'll just continue to come in every 3, 4, 5, 6 months to get the new pellets. As long as you're feeling good, we won't need to do the labs more often than that. It's just kind of that first year setting up. So hopefully next week, I keep saying that, hopefully next week I'll have everything sorted out and then we can get that squared away. Other than that, we still have the regular membership options. So that's the $129 a month. And you get a couple things complimentary with that. Monthly B12 injection, monthly in-body assessment. So that's the assessment that tells me your muscle mass, your body fat mass, your body fat percentage, your BMI, your basal metabolic rate, a lot of stuff that can help you kind of gauge your diet and help you lose weight if that's something you're interested in. So that's complimentary every month. Hi, Isabel. And then you can also pick between a IV. So I have several different IVs just depending on what you're looking for and what is bothering you. So fatigue, I've got special concoction for that. If you feel like you're getting sick, immunity, I've got a special concoction for that. Skin health, metabolism boosting, all that stuff. So you can pick one of those, or you can do an IPL photofacial. So that can be done for 2 different reasons. It could be done for like sunspots, sun damage, those little brown spots people get. Or we can also do it for redness and rosacea. And then we're also utilizing that same IPL for dry eye treatment. So there's a couple different options. On top of that, you get 15% off any other services that you buy. And there's special discounts on all the injectables. So like all the neurotoxins, Botox, Dysport, Xeomin, and $150 off for each syringe of filler that you want to get. So that's all the perks that comes with the membership. If you're gonna do those things monthly, like the IPL facial alone is $300, and the membership is only $129. So you're gonna be saving money in the long run. Another thing I do is if you don't use that monthly fee, the $129, say you don't come in that month for any of your complimentary stuff, you won't lose that $129. It's going to roll over onto your account. So you'll be able to utilize that towards any service in the future. So it's not like a use it or lose it kind of thing. The next thing I wanted to talk about was what else? I forgot. Liam's playing with the dog, if you hear. I think that's it. The next thing I wanted to talk about. So I think I was just going to kind of talk to you guys about myself. So you can kind of get a little background as to where I'm coming from, where I've been, what I've done. And maybe that will help give people a little bit more confidence in me treating them. So basically, when I got out of high school, I was pre-med at the University of Arizona. And I needed a job, a part-time job. So I went to apply for a 911 dispatcher position at the sheriff's department. They had a part-time position available. So I applied for that. And then as I was putting my application in, the lady at the desk said, "Oh, the sheriff's department's hiring at the jail. Do you want to put in for that?" And I was like, "Okay." And so I just put in for it like on a whim. So I put in for that and I ended up like really enjoying it. So I quit school, of course, and started doing that full time. I was about 4 weeks into the academy when the dispatch position opened up, and I opted to stay in the sheriff's department. So ended up being there for 11 years. Went up through the ranks, officer, sergeant, lieutenant. Was managing anywhere from 80 officers to like 2,000 inmates, different facilities. I helped build and organize the new juvenile detention facility. So a lot of experience in that, just kind of with interpersonal communication skills, dealing with a lot of difficult people, a lot of people on substances, stuff like that. Then I met my husband there and we got married, and he always wanted to be a pilot. So we decided if we're going to do that, we're going to do that before we have kids. So he did that. We ended up moving to Alabama for 2 years. Hello, Sonny. We ended up doing that for 2 years, and the sheriff's department wouldn't hold my position while I was gone, so while we were there in Alabama, I went ahead and finished up my prerequisites and applied for my Bachelor's of Science, application at the University of Arizona. So when I got back, I got accepted to that program, and then I finished my bachelor's degree there at the University of Arizona, and that was a 2.5 year program. So I graduated with that, got my bachelor's. At that point, we were moving again. So we moved to Mississippi, and I started my career in nursing at Mississippi. So that was at University of Mississippi Medical Center, and my first place there was on hematology oncology, which was pretty rough. But it's funny because the cancer runs pretty rampant, particularly on my mom's side of the family. So I had always been interested in um, oncology. And when I graduated high school, my grandmother asked me what I wanted to do, and I told her that I wanted to be an oncologist. So it's funny that I kind of ended up there, anyways. So I did that for a couple years, and then I ended up going to a long-term acute care. So long-term acute care is a place where people go from the hospital, from ICUs or step down units, who are not able they're not able to wean them off the ventilators, or wean them off vasopressive medications. So medications that are keeping their heart rate up, medications that are keeping their blood rate up, those kinds of things. Unfortunately, insurance runs out on that kind of stuff, and they can't stay in the hospital forever. And obviously, patients and their families have a very hard time taking people off of those kinds of things. So they end up going to a long-term acute care where we take care of them, and it kind of goes, um, kind of starts there. Hello, Danny. So it kind of starts their journey over again as far as insurance goes. So they get a little bit more time to decide what do I want to do with mom or dad or sister or whatever. So, got a lot of experience there, additionally with critical care, and ended up getting my critical care certification, which is I think it was almost harder than the my NCLEX to get my nursing degree. That critical care certification is pretty hard to get. So I ended up getting that, and then we moved again. So by the time we left there, I was actually the director of the hospital. So which is just like one step down from the CNO. So I was a director there for maybe a year before we ended up moving to Florida. When I got back to Florida, I went back to hematology oncology. Hello, everybody. I went back to hematology oncology and was there for a couple years, from 2018, I believe, to 2020. So was in hematology oncology, got my oncology and chemotherapy certifications while I was there. And then COVID hit, right? So I started going back to school in Mississippi to for my doctorate program. I always wanted to do aesthetics, and so in most states you have to have an advanced degree, either a master's or a doctorate, to do that. So I was going to go back to school. Why stop at your master's when you can get your doctorate in another year? So I went ahead and started my doctorate program, and that was while we were in Mississippi. And so I moved to Florida, got my hematology oncology certification, and then COVID hit. So cancer patients, people actively going through chemotherapy and radiation, were not coming into the hospital anymore. those kinds of patients have diminished immune systems, and if they are exposed to anything, it can kill them. They could get a UTI and die. They could get a cut in their finger and die just because their immune system is under attack already from the chemotherapy. They can't fight anything off. So those kinds of people, they don't get fevers, they don't start getting the chills, they get totally random weird symptoms when they get sick. And a lot of times they don't even know that they have an infection when we find out they have an infection. So those people could not come to the hospital at all. And it was funny, but not funny. My mother-in-law at the time was going through breast cancer treatment, and she's the one who watches my kids. So I was on the COVID unit. So that's not good. I didn't want to expose her to those kinds of things, to COVID for sure. She was actively going through chemo, and that wouldn't be a good thing. So we kind of set up a detox like room out front of the house. So when I would come home, I could take everything off, put on a gown, and immediately go inside and shower and change. I wouldn't let the kids touch me. I wouldn't touch anything, leave all my clothes out there, and I would bring them in like once a week to wash them after everybody was gone. And then after I showered, then I could be with my family again. Um, so luckily, she never got it. She would leave before I even entered the house, so I wouldn't even have any contact with her. We were very careful about it. It was just it was like a movie, you guys. Like, it was like, just, I remember, I have like pictures in my head of walking down the hall, and it looked like a movie. Like, there was hazmat suits everywhere, and gloves and masks. And, like, we wore the big N99 mask. It was insane, and we were running out of things. We were running out of gloves. We were running out of gowns. We were running out of ventilators. We were running out of BiPAPs. We were running out of oxygen, just regular oxygen cannulas. So we were making really hard decisions a lot of the times about who's going to get the next ventilator after this guy dies or after this girl dies. We had to make decisions about stuff like that. Does this 55-year-old man get it? Or does the 32-year-old woman get it, who just came into the hospital to have a baby, and then she ended up contracting COVID? So it was a disaster. Everybody was burned out, depressed. Lots of people left. It was a mess. So that was COVID. So, we ended up moving a little farther up north. That was in Boca. So after we moved from Boca, we moved up to where we are now, and I worked at Traditions, Cleveland Clinic Traditions, and I was there a couple years, and or a year and a half, I guess, until I graduated. I was there, which I graduated in late 2020. So thank you, Isabel. Isabel said so much love and respect. So it was hard for sure. But when I got up to Cleveland Clinic, since I had kind of been everywhere, right? So I worked critical care, hematology, oncology, and often got floated to a bunch of units. Obviously, knew telemetry, which is the cardiac unit. So you have to know that kind of stuff to be on the ICU. The only thing I kind of wasn't very good at was orthopedics, and that's funny because that changed later. So once I got to Cleveland Clinic, I was a float nurse, and they loved it because I could go anywhere. I could go to the ER, I could go to the ICU, I could go to step down, I could go to med surg, I could go to telemetry. Wherever they needed me, I could go. And so I finished out my degree while working there at Cleveland Clinic. Then after that, I started working as a nurse practitioner with my doctorate at a primary care, which I loved. I loved my patients. I loved helping people. I really found that quite enjoyable. I didn't like where I worked. I didn't like how they treated me. So that necessitated a change in jobs. And I ended up going to a spine and orthopedic clinic, which I was terrified of because, like I said, orthopedic stuff was not something that I was well versed in. So a lot of self studying and kind of shadowing people and picking other nurse practitioners' brains, and a steep learning curve, working late nights, trying to learn all that stuff. And I ended up really enjoying that job as well. And I learned a lot, and I worked with a lot of great people who were patient with me and taught me a lot. So that was a great job. I love that job. So, but they always knew my heart was in aesthetics. So I eventually did get a position in aesthetics with a physician who's up in Port St. Lucie. She's a well-respected physician. She's been there, like 20 years, and she was nice enough to take me under her wing and let me use a couple of her rooms that she wasn't really utilizing. For aesthetics, she hired a nurse practitioner from up in Melbourne to come and train me, which I can't imagine how much that cost, but she didn't make me pay her back. It was just an awesome opportunity that never happens. Nobody ever offers that. You To find your first aesthetic position is so hard because they all want you to have experience. So for her to give me that background and everything, and that one-on-one training with that other nurse practitioner was phenomenal. So I worked with her for a while, and then I worked at another med spa, um, for a little over a year. Learned a lot there. I had another, PA that I worked with there, and she's amazing. She'd been doing it about 17, 18 years as well, and learned a lot from her. And then my husband kept asking me, how long are you gonna make other people money for?" So, kinda started my own place, and that's up in Port St. Lucie. Ended up he the owner at the time was hiring. They were just opening, they hadn't opened yet. So, I was applying for a position there, and then after I was there a few months, basically he was like, "Hey, do you wanna buy into this company?" And absolutely, so I did. And that's where we are now. And since I've been there, I have learned a ton about business because I know nothing about that, but now I know a lot in the short amount of time. But I've also continued my education. So I keep going to trainings, Galderma and what's the other one? Alley. I can't remember the name. The makers of Botox and Juvederm, I can't remember their name, I don't know why it escapes me. Anyways, they always put on a lot of training that, dinner training, or they come to the clinic and help train you and stuff like that, so that is an ongoing thing, and things in aesthetics change so much, so so fast. So you gotta keep up with that kind of stuff. So just in these past couple months, like bioidentical hormone replacement, weight loss, hormone replacement, that with the pellets, learning that was all I've done all that since I've opened my own practice. Danny, thank you. Danny said, "We're here to support you during your business journey." So if you guys don't know Danny, you guys should check him out. He's with Port St. Lucie Business Club. They're a great little organization. They're not so little anymore. They're getting pretty big, but they're a great organization. That's where I started. That's where I met a lot of people and got a lot of good tips from them. So if you guys haven't seen them, again, it's Port St. Lucie Business Club. You can find them on Facebook. They're great. Um, so anyways, and then I also started learning much, much more about PRP, and that was thanks to a couple of my patients actually who had just mentioned, "Have you ever heard of this?" And I was like, "No." Like, and in my head, I'm like, "That doesn't work. That's silly," but it actually was a thing. So that's how I learned to make your own filler out of your own PRP, and how PRF is oftentimes superior to PRP. So it's just a constant learning thing. And now the the ball is kind of getting rolling. In addition to aesthetics, I would like to start doing more wellness things and things that are more natural. I think a lot of people are headed that way as far as, filler. I've always told people filler doesn't go away. It's always there. And now people are starting to see that with these MRIs that are coming out. It does dissipate, but there's always something left. And that's a lot of times why I think people start looking weird is because they say I did a syringe last year, so I'm going to do a syringe this year, and they just keep doing it over and over again without realizing that some of that previous syringe is still in there, so you're just adding on top of it. Um, and they also kind of get body dysmorphic, and there's nobody to tell them to stop. So that's where I come in. But um, at any rate, a lot of things change, and there are more natural approaches to things. The hormone replacement, the PRP, I do the PRP for joint pain. I did PRP on Danny's plantar fasciitis, some knee joints, hip. I've done my own hip a couple of times. In addition to just bioregenerative type of medication. Sculptra is along with that, Radius is along with that. Just some things that just call upon your body to do its own things, because your body is amazing and it can do so many things if you just help it. So like vitamin replacement, people don't realize how important vitamins are. Even vitamin C, you don't understand how important vitamin C is until you get down to what it does. So there's a lot to learn still. I'm still learning a lot, but I appreciate everybody who's supporting me and everybody who's come by. I've enjoyed getting to know all my new clients, and some of you have become friends, and I love that. And I want it to be like that there, where it's like a family supportive environment. You come in, everybody knows who you are. It's just like you're coming to another house, where I can take care of you. So that's all I got. If anybody has any questions, I will open the floor up for questions. If not, I will let you all get back to your Monday evening. I'm glad you could catch it finally. Let's see. Oh, we got a lot of people on Instagram. Cool. Thank you guys so much for coming. All right. Come here, bud. I'm going to pick a winner. All right. So come over here. We got JFK, JH, J Cleaning Service, Isabel, Janet, Brand Driven, Sunny. That's Isabel again. Or Jessica or Rosa. Or over here we have Danny. So who is it? Who are you going to pick? You want to spin the wheel here? Just pick somebody.
I feel like the most desperate. Daniel.
You're picking Danny?
Mm-hmm.
All right. Danny, you're the winner. So here's what we're going to do for you, Danny. Let me think. Something good for you. Are your heels still hurting you, or are you feeling okay? Let's see if he answers. Hopefully they're still feeling good. I gave Danny some PRP injections for his plantar fasciitis, and he's been doing pretty good. He's not paying attention. So let's do for Danny. Danny is on killing it at the gym and getting on this health journey. So I think what I'll offer him is he could pick one of two, depending on what his blood pressure is. Once again, I'm winning, he says. So depending on what your blood pressure is running, Danny, we will do IV of your choice. We could do a wellness one with amino acids and stuff for muscle repair and that kind of stuff. Or I could do an M-shape treatment, which you haven't done yet, and I think you'll enjoy. So the M-shape machine is the one that kind of does 20,000 squats or 20,000 sit-ups or something like that in 30 minutes. It's amazing. And it also helps you burn about 30% of fat. So when you do that, you will be sore. Blood pressure is all right. Let's not do the IV then if your blood pressure is too high. I just told Dahlia the bottom of my feet have not hurt since doing the PRP. That's great. It's been a couple months, so that's good. Good. I'm glad. I gave a girl the other day I gave a girl the other day a PRP injection in her heel. She's at the barber shop in Stewart that I go to on Fridays. And I just saw her like limping around and I just saw her like limping around and so I was like, "What's wrong with you?" "Ah, my heel's been killing me, you know, so now it's hurting my knees hurts because of the way I'm walking or whatever." And I was like, "Get back here." So I gave her a PRP injection and I told her I put some lidocaine in there to give you some like immediate relief to kind of break that pain cycle. It's a cyclical cycle. Once you get in there, it's kind of hard to get out of it. So I put some lidocaine in there to kind of help break that. And then about 20 minutes later, she's hollering my name and I go out there and she starts dancing. She's like, "Oh my god, I feel so much better." And I said, "Wait, that's probably just the lidocaine, so give it an hour or so." But even an hour or so later, I said, "You may be one of the lucky ones like Danny who where the pain just stops and it never comes back." And she was just like Danny, like she texted me later that night and she actually started crying because like she it had been hurting her for so long. So I was happy to do that. So, Danny, we'll do the M shape whenever you like. Come on in, on a body part of your choice, abs, arms, whatever you wanna do. And with that, I will let everybody go, and I will see you guys next Monday. If you have any topics or ideas you want me to cover, please let me know. Other than that, have a great week.